went to an event run by SWEET, which stands for Service User Involvement in Training and Education. Did I mention that I wanted to be informed as a carer? Well, this event catered for my needs. The event was called Empowering Family and Carer Event, and the theme was on medication. This event is for people who care for those with mental health illnesses, that being perhaps a family relative or friend, maybe even a neighbour. The event was held over at Mind in Croydon at Fairfield House over in East Croydon, and this event ran from 3:15 to 6:30 p.m. So then, what did this event cover? Well, we had health professionals talking about the following subjects, being care and treatment, welfare and benefits, PALS, which stands for Patient Advice and Liaison Service, and also peer support, amongst many other things. Who was there on the day giving advice? Well, first we had Angela Mitchell, who is the SWEET training advisor. She was chairing the event, and she also helped set the event up. Let's get a bit of background on Angela Mitchell. Now, Angela develops and delivers in-corporate induction for all new staff, including combating stigma, service user perspective and recovery-orientated practice, customer care, working with family members and carers, and mental health first aid. That's commission only. Her area of expertise is in mental health awareness, involving service users in their own care, combating stigma, and promoting social inclusion and mental health first aid. Angela Mitchell joined the NHS in 2008 and had been developing and delivering training in mental health awareness, corporate induction for all new staff, including customer services for frontline staff, combating stigma and promoting social inclusion from a service user perspective, and recovery-orientated practice, also commissioning training in mental health first aid. Next, I met Bridget Jones, who is a carers consultant and advisor, and she also helped Angela Mitchell set up and run the event. I have known Bridget for some years, and she is a carer herself and has been working at SLAM as a carers consultant for some time. She is a brilliant maths teacher and is well versed in teaching, mental health, research and public speaking. Then we heard from Dr. Jane Sayer, who is the interim director of nursing for SLAM, and she spoke about what had been achieved for family and carers throughout the trust from around about 2012 to 2013. Now here's a quick bio about Dr. Jane Sayer. Jane is a mental health nurse currently working as acting director of nursing and education at South London at Maudsley NHS Foundation Trust. Since qualifying in 1990, she has worked in inpatient and community mental health settings and as a practice development tutor. After completing an MSc in clinical mental health nursing, she worked as nurse advisor for the Learning Disability Directorate at South London and Maudsley NHS Foundation Trust. During this time, she had completed her PhD at the Institute of Psychiatry, King's College London. Next we heard from Angela Christinis, who provides carer support, social networking at Mind in Croydon. Then we got a presentation from Rob Brown, who is the counsellor and supervisor working at Mind in Croydon. He talked about the carers counselling service. Next we heard from Jackie, who manages the Mind in Croydon building, talking about the services being provided and what is changing. Then we heard from Bridget Jones talking about how she is involved in the suite service and training, and explaining a bit more about the stalls and surgeries and what else is going on at the event. Plus, Bridget also broke down some of the jargon which carers have to struggle through and answered questions regarding carers' problems. Then we heard from a carer talking about his experiences as a carer and also trying to reach out to other carers, stating that they are not alone. Then we heard from Esther, who is the Learning and Development Advisor working with SLAM, and she gave us updates about her peer support groups she plans to run. Next, we had a chance to visit the stalls, and we had carers asking questions from those who spoke at the event. And then we had a break and had some refreshments provided by Mind in Croydon at the event. Coming to the close of the event, we heard from Georgina Boom, who is the senior clinical pharmacist over at the Bethlehem Royal Hospital, and she was talking about medication and how mainly carers or focus groups tend to ask about medication, and how how carers can work with the hospital pharmacists and providing adequate medication for service users. In this audio blog, I decided not to fully play the talks from those who talked at the event, but you can hear the presentations off the SLAM TwigOps blog site if you wish. Now, before we move to a quick breakdown on what each speaker had to say, let's hear just a bit more about what SWEET actually does. Now, as I mentioned before, SWEET stands for Service User Involvement in Training and Education, and they work with SLAM service users to provide them with practical advice, training, support and encouragement so that they may use their skills, talents and experiential expertise to contribute to mental health education and training in ways that feel safe, appropriate and meaningful. SWEET organises regular events around the Trust for family members and carers to find out a bit more about mental health services available to them. Professionals are available to talk about medication, welfare benefits, peer support and care and treatment. So I encourage family members and carers to contact SWEET, especially if you're in South London, about attending these much needed and important events. Well, let's have a quick rundown about what those who were at the event talked about. As I mentioned before, first we had Angela Mitchell, who was hosting the event, and she spoke about what the event was about, a bit about herself, plus her caring duties. Let's hear a bit from her talk.
This event, so we have partnered up with Mind for this event, which is really great because it means that we can come out to the hospital sites that we have. But it's been in partnership with SLAM and part of SLAM with SWEET, but also actually we've involved lots and lots of SLAM staff here as well. SWEET stands for Service User Involvement in Training and Education, and this is a carers event, so we have carers involved in the planning and development and production of this event. And specifically, I'd like to introduce and thank very, very much Bridget Jones, who's here today, who's put an enormous amount, thank you, into making this event happen today. So thank you so much. And also, Bridget is fantastic at tweeting. So she tweets, she also Facebooks. I don't think you can say that, but just made that one up. Anyway, so please do check out Twitter and Facebook, because she will, I know, be writing up all sorts of interesting things about this. You know. And hopefully that way more people will find out about this event, because I only spoke to somebody today who said, but I haven't heard about this one. I said, this is our 7th event. And she's like, but I've never heard of it before. So obviously we need to do a bit more. We did advertise in the Croydon Guardian, if anybody saw that. Oh yeah, lovely, fantastic. So that's something we're also exploring as well, is advertising a little bit more widely. Actually, I forgot to say that Bridget's our sweet tiger. You can ask Bridget what that means afterwards. She's a sweet tiger.
Sweet tiger.
Yeah. But she'll let you know what that means. We've got a few tigers actually, one sweet. Anyway. And I've lost my place now. Okay, put me off. Okay, just a little tiny bit about me, because I'm only just a little bit today, and then we've got lots of presentations, so I don't want to take up the time. I view services myself. I'm also a carer and a family member. But I think a lot of people don't realise that you can be well and have a diagnosis. Okay, and I just want you, because the event today is the theme is medication, so I thought it was appropriate to say that medication plays a big part in keeping me well. It's not the only part, but it is a really important part. You know, I also have to exercise and, you know, keep in touch with friends and family and do all the things that, you know, everybody does. I have a diagnosis of bipolar, and taking medication probably will be for the...
Then next we heard from Dr. Jane Sayer, and what Jane talked about was what has been done for carers within SLAM Trust for the last year, working more closely with GPs, looking at different ways of providing care for service users, confidentiality, and a bit more. Here's a taster from her bit.
So I was just going to tell you a little bit about what I think we've been doing in the last year. And these slides are taken from a big event that we run annually, our carers event that we had a couple of months ago. So this is just an overview. And the pieces of work that are up here today are priorities that have been set by carers the year before. So what we do is we say to our carers annually, so what are we doing well at, and what do we need to work on more from your point of view? So these are the things that they said they wanted us to help with. So the first one was, how do we encourage the relationship with primary care? So there will be GPs, practice nurses, etc. Because we know that carers often go to GPs as the first point of contact. So it's really important that when you do, GPs recognise that not only are you asking for care for the people that you love and care for, but sometimes you must care yourselves. Because if you're not well, how can you care for other people? So this is a really important relationship for us. And sometimes that will mean that you need to involve secondary mental health services as well. So ourselves in making sure that you get the right support. That's really important. So we've been working with link workers going into primary care, and I'm sorry we've got some acronyms on here. So CMHT is Community Mental Health Team Link Workers. So people from our own community teams working with GPs to make sure that we're getting it right for people who are caring. And the other thing that we've been doing in the trust that you might have come across, if people that you know have been admitted, is in most of our services now we have a triage ward. I don't know whether any of you have had people admitted to triage. So rather than admit everybody to an acute ward straight away, where you'll have people who are newly admitted, people in the middle of their journey towards discharge, and people ready for discharge, we take people into a ward where we can do an immediate assessment of them. And some people only need to be there a couple of days, and then we discharge with the right care. And what it means is...
Okay, next we heard from Angela Christina, the carer and support worker. And she talked about what support is provided for carers by Mind in Croydon.
Yes, so as Angela says, I'm the carer support worker for Mind in Croydon. It's a relatively new service for us, and we're part of the new carer support network. Some of you may have seen the new shop office that's opening up down the road. Lots of carer services involved, and hopefully making it easier for carers to find information and to access what's out there. So we've been up and running since about October. We provide various sort of forms of support, one-to-one support, carers, groups, emotional support, advocacy. Our groups run twice a week. We also have training and workshops which we provide for carers. There is more information here, so if you do have any questions, just come over. I've got information on the times and days of the groups. I think that's probably all.
That's lovely. Thank you. That's great.
And I'll introduce you to Rob, who runs our carers counselling service.
Then we had Rob, who is the carers counsellor for Mind in Croydon, and he talked about the counselling service for carers.
Hello, I'm Rob Brown. I'm a counsellor and a supervisor at Mind in Croydon. We're based at Pampersford Road, right down in Purley, where the big roundabout is and the big Tesco's. We've had a general counselling service for a long time at Mind, and since October last year, we've had a special service for carers, a carers counselling service. And the difference is that this service is free of charge for service users. So you can have 6 sessions free of charge with the possibility of a further 6. So you could have up to 12 sessions. So this is to really support carers with psychological difficulties that come about from their caring role. We've got 32 counsellors at Mind, and we're open Monday to Friday, 9:30 till 5, and open also on Monday and Thursday evenings until 9 o'clock. So we've got quite a broad range of availability. So the people who are eligible are carers who are over 18 and live in the borough of Croydon. You can self-refer, you don't need a GP referral. What happens is someone will...
Next we heard from Jackie, who manages Mind in Croydon, and she talked about the services for service users and how they provide support for the service users.
As Angela said, my name is Jackie and I manage this building here. And from this building we've got several services. So we've got the social network service where we work directly with our clients, service users in Croydon. And we find meaningful activities for people to do in the community through the social network service. So we do lots of group work. We do lots of one-to-one. Mainly we support the service users to stay out of hospital. So that's one of our main roles as social network caseworkers. Our service, we work with up to 210 service users in a year. So although you might not see anyone around, and we're here, we're still working, and they're all out doing things we hope, but meaningful activities. So it could be volunteering, it could be education, training courses, going to college, whatever the service users would like to do, we try and make that happen for them.
Do they have to be referred to?
They do. The way the service was set up, nearly 4 years now, is that the service user had to be in a CPA, and they had to be referred by...
Then we heard from Bridget Jones, and she was next to speak, and she talked about a bit about herself and her involvement in Sweet, the stalls and surgeries, introducing those running the stalls.
I'm also a carer. I've only recently started working with Sweet, and it's really been great to be involved in helping to plan this event. I've really enjoyed it. And I've found that my caring role goes up and down a bit, so there are times when I can get more involved and times when I can't, which makes it really nice being involved in something like this when I can. Which is great. Just to introduce you to surgeries today, we've got several running here today, and please make most of the opportunity to go and chat to people. We've got the medication pharmacy surgery right at the back there with Georgina Boone, who's doing... Thank you, Georgina. Do wave. And Rhiannon, have I pronounced that correctly?
Yeah.
Who's there can be here to answer any questions you've got about medication. We've got care and treatment surgery over there, is that right, that table there? Care and treatment journey and jargon can be really difficult to understand. I know I struggled. I didn't know what a CPA was for a long, long time. So there's people here that can help you with that. They're all the people on that surgery are qualified nurses. We've got Caroline Green, Deputy Director for Education Training. We've got Brian Hanna, Head of Promoting Safe and Therapeutic Services. We've got Esther, who you just met. And they're all here at Care and Treatment Surgery to help you. We've then got PALS. Thank you, Karen. If you've had any difficulties with the service received, Kieran's the man to speak to, but also it's nice to know when things go well. PALS like to know about that too.
Then surprisingly, it was me, being Matthew Mackenzie, and I talked about my experience as a carer, the problems carers face, how I felt as a carer, confidentiality, a carer's view on medication, my thoughts on the future on my caring role, which perhaps can relate to other carers out there. My name is Matthew Mackenzie, as you can see, and I'm just going to give you just a short story of my role as a carer. I just hope that my experiences can help other carers, and that we can relate to a few things about what carers go through, or what you may go through in the future at some point. Now, I'm not from around here. I'm actually based in Lewisham, not in Croydon, so I'm sure some of the carer services here will be slightly different. But regardless of where you live, please make sure you use those services. Obviously, there's no greatest. It's not an extensive list. Obviously, there's more than that anyway. I might have missed a few things. But there's no greater substitute to the caring role than a carer's experience. But as you can tell, many of the stalls and speakers here can provide information and knowledge that can help you cope as a carer. Now, who do I care for? I care for my mother, and have been caring for her for 9 years or more. But I consider the carer's role to be quite a difficult job, and it is a job, no matter what anyone says. It can be rewarding, knowing that you're providing care to a friend or relative, but I sometimes feel that carers can, and sometimes feel that they are ignored. I also feel that they can suffer and face financial hardship, and they often have to give up life choices and what they would like to do. These are the problems, exactly the problems what I went through in trying to provide care for my mother, which was made more difficult since she was unfortunate enough to be struck down with mental illness. What else? As you can see, I know it's not that clear, but there's another two people there, and that is I try and care for my two brothers. Both my brothers have autism, and my mother is actually one of the main carers of my brother because he lives with her, and as I pointed out earlier, she's trying to cope with difficult circumstances, which makes her caring role rather strained. So, how did it happen? How did I fall into the carer's role? And this is the question that many carers actually ask. We then heard from Esther, who is the Learning and Development Advisor. She talked about her peer support groups.
I'll be around, so if anyone wants to talk to me, you're very welcome to do that. And when, at 5 o'clock, I'll be running a very short, sort of 10, 15-minute taster session, so I can talk a little bit more about that. And we'll be upstairs. We've got a little room set aside so we can have the space. And it's really about people getting together. I think lots of people have said how useful it is to hear from others. So that's what I want to do. Provide a space for people to talk and learn from each other. So you're not on your own. So 5 o'clock.
Excellent. It's a day. Thank you, Esther.
After visiting the stores and surgeries and eating lovely food and refreshments at the break during the event. We then got to hear from Georgina Boom, who is the senior clinical pharmacist. Her presentation was on medication being the following: what a pharmacist does, how carers can work with the hospital pharmacist, combating side effects, types of medication.
Quite a few of you here today. I've come to speak about medication and how carers can help, how pharmacists can help. There's a few different questions that have come up before from carers and from focus groups, so they may not be your exact questions. There may be a lot of questions that you still have that I won't answer in this. We'll hopefully be able to answer some of them later. But this is just a kind of a brief summary of things that we hope that you might want to know about. Thank you. So, common issues that are...
Yeah, flick it on, that's okay.
So one of the first questions you might have is, what does the hospital pharmacist actually do? Because you might see pharmacists, say, in community, in, say, Boots, Lloyd's, high street chemists, and you see what their role is. But the role of a hospital pharmacist is really to help make decisions upon prescriptions, on medication plans for patients. So we're quite involved with the doctors and with the nurse prescribers, and we sometimes go to ward rounds. We will be on the wards once, maybe twice a week, so you might not see us in the hospitals as much as you would the other healthcare professionals, but we are there, and we're there to talk to yourselves and also to your loved ones about medications, and we do try and advertise as much as we can to nurses on the ward that if patients have got specific questions about their medicines or concerns, to arrange to come and speak to us as a one-to-one or with family there if they want to. Thank you. So, does it take more than medication? Well, of course it does, and we know that medication is just one small part of a whole treatment plan in patients' road to recovery. There's obviously family and care support, social support, psychology, there's a whole range of different things. As people have said already this afternoon, medication isn't right for everybody. Some people will need to be on medication for life, so it does vary, and it's very individual as to what medication plan people need to be on. Thanks. So one of the questions that tends to come up quite a lot is, where do you go to for information if you feel that you're not...
Well, what did I think of the event as a carer? It is difficult not to be biased, because, to be honest, I actually spoke at the event, but I went in the event as a carer, and I guess I left the event as a carer. I must admit that such events are needed because it's a chance to network with other carers and health professionals. You can raise your concerns and learn from each other. I felt that speaking at the event gave me an opportunity to be heard, which most carers do not have the chance to do. I noticed most carers at the event spoke to me after my talk to relate to what we all went through, and I must admit I was almost fighting back the emotions as I heard from carers struggling on ways to cope. We as carers must not remain isolated. There are services out there trying to make things easier for us. People out there that recognize our role and those who want to hear from us. It is through these events that we can all work together and make a difference, not only for us, but for other carers who remain trapped, isolated, and lost in the system. As a side note, I would like to mention that the 30th was the day before my birthday, but to be honest, that day felt so special I almost considered it as an early birthday present, because I felt not only did I contribute to the event, but I felt that I helped other carers who were in a similar situation to myself.